Hi, my name is Hiram Diaz, and I chose the St. David's School of Nursing at Texas State University because it's located in a vibrant city with a very rich healthcare environment. I first looked into the program around the end of my sophomore year when I really started focusing on what I wanted to do for my future. Around this time, I also enrolled in the Collegiate Academy program, which gave me the opportunity to graduate high school with my associate's degree in arts and in science. Because I took the time to really look into the program and research the curriculum, I feel beyond prepared to really thrive in a program like St. David's, and I feel like I will have the opportunity to really become that kind of nurse that can really make a difference in our community. One incident that prepared me to want to become a nurse in a diverse community was the passing of my grandmother. When I was around 9 years old, my grandmother did fall in hospice, so my father and his siblings all had to take care of her. But as weeks went on, the stress and the exhaustion really took a toll on all of them. My family ended reaching a breaking point, while some of them decided that it was best for her to send her into a nursing home. Others thought that it was best for to keep her home and to just keep taking turns taking care of her. But sadly, they ended up putting her in a nursing home, and within 3 weeks, she did end up passing away. The healthcare in Puerto Rico has never really been the greatest, so by putting my grandmother in a nursing home, my father always knew that that was not going to be the best choice. My father understood that Puerto Rico's healthcare was not the greatest, and that there were a lot of risks that were going to come with that, but his siblings always ignored his concerns. The pain that my family really went through really made me realize how crucial it is that families have that trusted advocate in their care. And while her loss really broke our family, it also really started my commitment for nursing. Um, I would love to really have the opportunity to work as a pediatric nurse so I can, one, give children and families the steady and compassionate care that they deserve, and for two, so I can ensure that they will never feel the same way that my father did about their healthcare choices. I would love for them to be able to feel safe, confident, and secure the with the healthcare that they're getting. My father always knew that the healthcare in Puerto Rico wasn't the best, and my goal is just to really be able to prevent that in other families as much as I can. My volunteer and work experience has also really influenced how where like what I wanted to do in my life. And I have worked in many restaurants. I've worked in Cane's, Chipotle, McDonald's, and I've also worked in a couple family-owned restaurants here in Goshe. And I really realized that most of our clients are often older adults that needed extra assistance. These interactions really gave me a deeper appreciation for the care and the patience that goes for all age groups. At the same time as work that I was working, I was also in many extracurricular activities at the high school that were mainly focused on community service. Because they were focused on community service, one of the main things that we did, we visited our local nursing home every Sunday, every the last Sunday of every month. So the last Sunday of every month, we went and we baked cookies. We made cupcakes once. We watched movies, made popcorn. We just made sure that the people at the nursing home really still felt appreciated and that they still felt seen. And that experience really gave me a sense of purpose, and it made me realize how much I want to be that steady yet caring person. Every interaction really taught me how important it is to really build trust with not only your patients but also the people around you, and to be able to provide comfort all while having a compassionate heart. I also realized that technology is a very powerful tool, especially in today's society. I know it, everybody else knows it, that technology has really grown into an amazing thing and it's really helped us in many ways. But I also noticed that it can also sometimes build a distance between the patient and the nurse. Things like video shards, Zoom, electronic shards, or even like just being on your screen too much can really build a wall between the patient and the nurse, or even the doctor as well. To overcome these type of barriers, I plan on being very intentional with my communication by making sure I establish eye contact, make sure I'm using empathetic language, and to ensure that I check in frequently with my patients to make sure that they still feel seen and secure. I I understand that technology has really influenced my decade and my era of upcoming nurses. So I would really love to be able to have a balance with technology. I understand that today's age, technology is a really important part of being in a hospital because it's everywhere that you see. So even when I'm like taking notes on like an iPad, or if I'm charting on an electronic chart, I still want my patients to still feel seen. I want them to know that I'm still present and I'm still paying attention to them and even engaging with them on a personal level. This way, I can still build a good level of trust, and this way that they still feel confident with like talking to me like on personal levels. And this way, I build a good personal level with my patient, so they don't feel scared or they don't feel some type of way by being in the hospital. So yeah, my once again, my name is Hiram Diaz, and I really appreciate you taking the time, and thank you for the consideration.